All right, welcome back to Daybreak. It's 1 minute to 7 o'clock on this 16th day of June 2020. It's Tuesday, and of course we continue with the coverage of the coronavirus pandemic that now we've been at it for more than 3 months, and the numbers continue to rise. I just want us to take a look at the state of the numbers that we have now. As of yesterday, we have 3,727 total infections confirmed. There are some 1,286 people that have recovered from the virus, but 104 have unfortunately lost their lives to the pandemic. And we continue with the numbers yes, so the total infections, like I said, 3,727. The active cases, therefore, if you deduct the number of people that have died and those that have recovered, you have the figure of 2,337. And the total infections, the total tests are 118,701. After that, we know that now the coronavirus has made its way to State House. 4 officers tested positive. The report was given yesterday, but the mass testing was conducted on 11th of June. That's sometimes last week. The officers have since been isolated to the Kenyatta University Referral and Research Teaching Referral and Research Hospital, that is KU. The families of the said officers and their close contacts have been traced and are being attended to differently. And then also we know that because of that, the access protocols at State House have been enhanced. Visitors or officers residing outside State House will be subjected to the reinforced access protocols, and then the president and the family are said to be COVID-19 free. That's according to a statement that was released by the State House spokesperson Kanzedena Mararo yesterday. And of course, the news that shocked the nation in as far as having those numbers there. So joining us this morning is the Chief Executive Officer of the Kenya Medical Practitioners and Dentists Council. Good morning, Mr. Daniel Yumbia.
Good morning, Sam.
Right, and of course the country is coming to terms with the reports of some officers getting or contracting the virus at State House. I don't know whether you have anything to say, but just to explain how this could be, because of course people would say that there are very many protocols that have been put in place to ensure that any person that gets into State House has been screened properly, but still you find people contracting the virus. I mean, what does this say about the virus, and what should we be concerned about moving forward?
Sam, I must say that nobody is free. Nobody's safe from contracting the virus. COVID-19 is a disease that is transmitted through close contacts, and therefore every person must take care of themselves. We as the Kenya Medical Practitioners and Dentists Council has put in place several protocols in conjunction with the Ministry of Health. In particular, I must say that we are looking at people practicing self-sanitizing, social distancing, and where necessary, avoid movement as much as possible. Of late, we have been involved in the process of developing the protocol for home-based isolation and home-based care.
Right.
This is a protocol that I would wish that members of the public could access for 2 reasons. One is that the presidential directive that counties building capacity and expand their capacity to about 300 beds or facilities for COVID positive patients. Right. Is something that we are not taking lightly as a council. And what has happened is that Dr. Eva Jenga, who is the chair of the Kenya Medical Practitioners and Dentists Council, has put in a team of officers drawn from all regulatory agencies. Is a multi-agency team, which is gearing towards moving into the counties to assess the preparedness. 2 weeks ago, we did send a team to all the counties, and they assessed an average of 30 facilities. And out of the facilities that were assessed, they did confirm that those facilities had a bed capacity of 1,450. Out of those facilities they visited, they established that they had 45 functional ICU bed capacity, as opposed to our projected in those 30 facilities of 83 bed capacity. So based on that, we have worked around the clock to ensure that the national government, in particular, has set up 7 health facilities for COVID-19, and this course begins with the Kenyatta National Hospital, Bagathi, which was the first to be set up, Kenyatta University Teaching Referral Hospital, Odhaya Hospital, and Madare, and the spinal injury. These are some of the 7 facilities that the national government has set in place.
Right.
Now, the county governments have indicated that they have so far 70 functional isolation or COVID facilities. And when we realize these facilities are in place, we have calculated and realized that we currently have only 2,075 functional isolation facilities for COVID-19, which translating into a shortfall of about 400 in terms of the number of the patients that you projected a few minutes ago. So we have indicated, and we are working closely with the county governments. We are looking at projected within the next 2 weeks of about 7,000 facilities to be functional. 6,931 beds are projected to be available from the 113 facilities that we have identified. The national government has moved forward to get facilities from non-hospital institutions.
Right.
And by this, we have identified 36 Kenya medical training colleges across the country. Realize KMTCs are spread across the nation, and therefore we have identified them for two purposes. One, these are training institutions for nurses, for clinical officers. These are institutions which have functional healthcare workers who are in place, and therefore the government is working towards converting these facilities into isolation. Now, if that is done, we shall be able to get the number of the isolation sites to increase. That is point number 1. Point number 2, in the hospitals, we are projecting to have at least the current bed capacity of ICU, which is 137, to be scaled up to 242. That will address the issue of the persons that will go into acute condition. Now, you realize that we are now moving from quarantine to isolation.
Before you go to that, Mr. Yumbia, I'm taking interest because of the figures that you're telling us now. And I will take you back to the 1,450 beds that you are talking about across the country versus now what we are saying, 300 beds per county. My simple arithmetic is that 300 times 47 counties would be 14,100 beds. But obviously, most of these, the current ones that you have would be in Nairobi because it is way ahead of other counties. Even as you said that you are moving towards enhancing the capacity to now nearly 7,000 in about 2 weeks, what goes into these facilities that has made it so difficult for counties and even the national government to enhance this capacity to sufficient beds?
I think what we got from the ground is that most of the facility counties had prepared a maximum number of 10 beds. Their projections were that, you remember, there are counties who are yet to get any positive case on their ground or on the ground.
Right.
And they had identified the hospital, the current health facilities that are running within the counties. The public kind of expressed their concerns that they wanted the COVID patients to be kept away from the normal hospitals, because you realize that 2 weeks ago, the government, national government, through the Ministry of Health, appealed to Kenyans to stop shunning going to hospitals. You realize that some patients are not going to hospital for their normal routine checkups simply because they are scared of the issue of COVID-19. And therefore, the county governments had anticipated a situation where the COVID patients would be kept within isolated wards within their existing infrastructure. Okay. And that the public was a bit hesitant to accommodate. And based on that, counties have gone ahead and identified facilities that are fully set aside to address this kind of a challenge.
All right, and now you're saying that in the next 2 weeks you'll have the capacity rising to 7,000, and most of these saying that they're from KMTC. Is there anything else you're doing to the beds, or it's just a bed mattress?
I didn't say that most of these are from KMTC. What I said is that KMTC will just give a PPAP because KMTC themselves are facilities that are being set up by the national government to support the county governments. Okay. And every county government has put in place structures. Those that identified their normal hospitals have gone ahead and identified some of the facilities they have identified shall be fully converted for COVID, while others have established certain wards in those hospitals. And therefore, I must say that to date, the counties are up and running. I think the issue of finances was a challenge in the beginning, but I think that's something that the Minister of Health addressed 2 weeks ago, and we have formed a team to go around. I think if we will come back in 2 weeks, I'll be able to give you exactly which county has what capacity. Okay. I'm not ruling out the hotspot counties, Nairobi leading and Mombasa, and of late we've experienced Busia having those upsurge of numbers, and Kajia. These are some of the counties that we are focusing on to ensure that more facilities are set up to address the challenge. And we admit that the anticipated upsurge is here with us. So we don't expect the numbers to keep going down. We are yet flatten the curve, and the curve is still going up. And then in an effort to ensure that this issue of patients being kept in hospitals is also addressed, we developed home-based isolation care guidelines for patients who have mild
asymptomatic. And so, Mr. Yumbia, so yes, at a time that the country is moving towards home-based care, of what use will this bed capacity be if patients can actually nurse from home?
No, I was saying that we are not moving every patient to go to home-based care. For one to go to be allowed to go for home-based care, there are conditions that we have developed. The eligibility is that this person must convince the healthcare workers that they do have a facility in place where they can be able to isolate themselves without compromising the status of the others. Number two, these people must have exhibited non-comorbidities, because if you do test COVID positive and you have existing conditions like cancer, you have kidney problems, you have diabetes, we cannot allow you to go for home isolation. But if you exhibit such other conditions which confirm to health workers that you are able to self-isolate, you'll be allowed to go and isolate at home. But these hospital setups will be for such patients whom the health care workers feel that they need to be monitored closely.
Right. Let me ask you this question, because looking at the statistics that we have so far, it would appear we have 2,337 active cases. But if you had to look at the patients that are admitted in hospitals and other isolation facilities currently, the figures are 564. How do you account for the disparity? Those people that have not died, they have not recovered, but they are not in hospitals.
Admittedly, there are two areas that you need to get to understand. One, there are those in hospitals, and there are those who are in isolation sites. We have designated places where patients can be isolated, those with mild conditions, those who do not require hospital care. And that's where I think majority are. However, I must say that tomorrow we do have a Zoom meeting with all the CCs for health. We have done a tablet, and we have requested them to give us the status on the ground to explain where they have kept patients who have turned positive. And some of the patients are being followed from homes. We have collected them. I must say that home-based care for positive patients is just a matter that we have started, and we shall be able to give status of the persons that we allow to go home, because even those who go home and they are positive, they must be accounted for, they must be monitored, and we must ensure that their conditions are monitored appropriately. Therefore, it doesn't mean that once you test positive, we will let you go to stay at your own home without control. We must ensure that the persons are followed appropriately, and those who give symptoms or indications that they require hospital care will have to be moved to hospital for treatment and management.
Right, and Mr. Yumbia, so we know that the 3 T's, testing, tracing, and treating, you might be doing testing and probably tracing, but how successful have you been? Because I remember some 2 or 3 weeks ago, the ministry released some figures that would indicate over 260 contacts at that time were wrong, and therefore you're not able to reach persons that are tested positive. How is the situation looking like now, and are you confident that every person that has tested positive, you've gotten in touch with them? If not, what is the gap?
I think I must say there is positive response by the involvement of county governments. What we do is that once we get the results, and the results are, we get the results early in the morning, around 11, 10 o'clock. By the time we release these results, we are now in touch with all the county directors of health, because most of the testing is done within the counties. And as a result, the county directors of health are detailed that these are the positives, and if you look through, there is always a breakdown. Which county has got, which numbers are in which particular county, and below the county, we also break them down to the wards. Therefore, and sometimes we also give details of the estates so that the counties are able to trace them. Now, you'll agree with me, Sam, that we've also built capacity for testing within the counties, and we have approved quite a number of laboratories which are allowed now to carry out the tests. So some of the results that are coming out are actually from the counties themselves, and therefore by the time we tell them that you have got 3 positives or 4 positives, the counties are already aware that these are the people they tested, and therefore it is easy for them to trace, and we release the results, and they get the results in good time, and by the time we are going public, our contact tracing teams are already on the ground. And that has been successful, and the people have been able now to give correct information. Remember, we said there were people who were giving wrong telephone numbers, and we're going further to give 2 telephone numbers, your own telephone number and the telephone number of your next of kin, and where possible, we are also getting email address where we are releasing these results to the persons. Therefore, I think that there is positive approach from the members of the public, which is commendable, and we just appeal for those that are going for testing to be accurate and to give correct information, because it is for their own benefit and the benefit of their relatives and the benefit of the country at large.
Right, and so moving forward, yes, you're saying about enhancing the capacity in the counties, especially the bed capacity. Are we doing similar efforts in having the staff that will be working in such facilities to be in a position to take care of the COVID-19 patients?
I want to also take this opportunity to thank all the other workers. I think things have been tough on the health workers who are on the front line, and those that have been working tirelessly and putting all efforts to ensure that this COVID-19 threat is brought under control. I must say they are doing extremely well under extremely difficult conditions. Number two is that each county has been given the number of health workers to employ, and county governments advertised those positions, and I'm sure that most of them are filled in their positions. We are yet to get feedback from that because health workers are a scarce commodity in this nation, and therefore we still encourage county governments who have not completed the process of recruiting additional health workers to go ahead and ensure that that is completed within the given timelines.
All right, of course, that would be important to ensure that we're able to contain the situation. But looking at the numbers, Mr. Yumbia, if you look at the numbers in May, it's on average about 117.6. And if this continues, then it means by the end of June, it will be at more than 5,000, actually 5,600 plus. So what would be your word, with all these measures that are putting in place, what would be your word in as far as the precautions that Kenyans are taking so that we don't end up with enhancing capacity, but also we reduce the numbers? What must we do in the coming weeks?
As a country, we must take personal responsibility. One is that keep social distance, sanitize yourselves, put on masks all the time, and avoid crowded places. And once you have the symptoms, please ensure you go to the nearest hospital for treatment. Those that are tested positive, self-isolate and follow the protocols that have been established. Those that have traveled recently, come into the country, ensure they self-quarantine themselves for a maximum of 14 days. Ensure that those that have gotten the infection also are taken to hospital as soon as possible, and their next of kin, their social contacts followed appropriately, and ensure that we report where we get cases of upsurge.
Right.
These ones must be reported appropriately, and people must ensure that they cooperate with the Ministry of Health officials to ensure that people who suffer COVID-19 are taken to hospital. And once they have been discharged from hospitals, we get them into the community and accept them and move on together as a community.
Right, and Mr. Yumbe, there's a viewer who is watching, that is Lazaro Kanyambok, is saying that the COVID-19 having reached State House, security parameters should be a warning to the ruling class to also stop behaving normally. I don't know if there is any differentiation, because we have seen some politicians congregating in a way that they should not. I don't know whether there is any double standards in how Kenyans are supposed to conduct themselves.
There are no double standards, and the protocols that we have produced together with the Ministry of Health and that we are enforcing are cutting across, and every person is required to adhere to the protocols, particularly the issue of sanitation and social distancing. If you have an office where people are working, ensure that there is spacing. And where you go to social gatherings, we have not relaxed the regulation, and therefore it applies to every person, regardless of their social status.
Right. All right. Thank you so much, Daniel Yumbia. He's the Chief Executive Officer of the Kenya Medical Practitioners and Dentists Council. Thank you for joining us to speak to us about that conversation on the capacity of testing, tracing, and treating coronavirus disease in the country. Now, after the break, we'll be speaking to the Governor of Nyandarua, that is Francis Kimemia. We still have one more interview after that, that is with Senator Isaac Mwaura, who is a nominated senator. He'll be speaking to us about the International Day of the African Child. So still stay tuned to that. Of course, continue sending us your views via Twitter at Citizen TV Kenya, at Samgituku, at Zinzi_K. The hashtag to use is Daybreak. And also you can text us via 22422. We're back in a moment.